In today's society, alcohol is greatly glamorized, especially through the media. It is not uncommon that we hear stories of celebrities and other influential people drinking and partying. But the truth is, there is nothing glamorous about alcohol or alcoholism, especially when you're dealing with an alcoholic parent. According to the U.S. National Library of Medicine, alcoholism is a disease in which you have a physical addiction to alcohol. Alcoholics continue drinking despite having problems with their physical health, mental health, and social, family, or job responsibilities. Alcohol may control their life and their relationships. There are many reasons people begin to drink. Sometimes people are depressed, have low self-esteem, or are peer pressured into it. But regardless of the reason, it becomes a serious problem when it affects your career or your children. Regardless if the parent was always an alcoholic or if the parent started drinking when the child was getting older, the alcoholism will be toxic to the child's upbringing. According to an article called Parent-Child Relationship in Children of Alcoholic and Non-Alcoholic Parents, families of alcoholics have lower levels of expressiveness, independence, and intellectual orientation, and higher levels of conflict compared with non-alcoholic families. This kind of environment is not a good place for a child to be raised in. Even a child as young as a toddler can show signs that their alcoholic parent is affecting them. In a study done by Ellen P. Edwards, the results show that children 18 to 48 months with at least one alcoholic parent had higher levels of aggressive behavior than children with non-alcoholic parents. This proves that having an alcoholic parent can affect your behavior at any age. As the toddler grows older, the negative effects get worse. A study done by the University of Buffalo shows that children of alcoholics are at an increased risk of higher rates of behavior problems and psychiatric disturbances. These behaviors will greatly interfere with the child's life when it comes to friendships and school. Once the child turns into a teenager, the risk for them to experiment with drugs and alcohol is high. According to a study by Melanie Chandler, teenagers were found to drink more frequently, more heavily, and more often alone than teenagers of parents without alcohol problems. She also found that many of these teenagers claim that they drink to cope with their parents' alcoholism. Drinking to help cope with anything is not good and can cause a person to develop a drinking problem. Behavior like that as a teenager can cause problems for the person as an adult. According to the American Psychiatric Association, children of parents diagnosed with alcoholism are up to 4 times more likely to develop alcohol-related problems than individuals in the general population. In conclusion, alcoholism is a vicious cycle in a family. The chances of the child becoming an alcoholic are high. But there are things that a family can do to help. They can persuade the alcoholic to go to a rehab facility or to go to Alcoholics Anonymous meetings. The meetings help recovering alcoholics stay on track by offering support. For more information on Alcoholics Anonymous, go to www.aa.org. Once again, alcohol can be very dangerous and very toxic for your children to be around. If you are a parent, make the right choice and abstain from drinking.